So when it comes to thyroid disorders, there are two main thyroid disorders. There's low thyroid hypothyroidism, and there's high thyroid hormone levels called hyperthyroidism. And they tend to have very opposite symptoms. To begin with, hyperthyroid, which is not as common as hypothyroid, is where the body has too much thyroid hormone. The thyroid hormone helps the body's metabolism and cellular reactions. When a person may suffer from hyperthyroid, symptoms can be increased sweating, feeling jittery, tachycardic, palpitations, increased blood pressure, almost as if you're stepping on the accelerator in your automobile and revving up the engine. That's what hyperthyroid is kind of like. Hypothyroid is when your thyroid hormone in your body is too low. And so those symptoms they're almost the opposite. People feel cold, they feel sluggish, their heart rate might be low as well, might gain weight, even get depressed. And so as you can see, they're very opposite symptoms. We distinguish the two typically through blood work and perhaps a patient's history. We look at blood tests such as a TSH, thyroid stimulating hormone, and the body's T4 or thyroid hormone level, sometimes the T3, because there's two hormones. T3, which is not as much produced as the T4. When those are high and the TSH is low, that's more consistent with hyperthyroid. And when the TSH is super high and the hormone levels are low, that's consistent with hypothyroidism. So when it comes to the development of thyroid disorders, there are a few different medical conditions that can cause it. One of them is an autoimmune condition where the body's own immune system attacks the thyroid gland, something called Hashimoto's thyroiditis. And it's interesting, when patients have this condition, sometimes their thyroid level goes really high, they go hyper, and then they burn out and go low into hypo. Again, it's an autoimmune process. There are other conditions that can cause thyroid disorders. Back in the day, iodine deficiency could contribute to that, and that's why salt has a lot of iodine in it these days. Sometimes structural, like for instance, if a person has a problem with their thyroid gland or the neck and they have a surgery that removes part of the thyroid gland, that can cause a person to be hypothyroid as well. And of course, there's a condition called thyroiditis, which is just inflammation of the thyroid, which makes it very inflamed, and it can leak out all the hormones. So we routinely screen for these tests through blood work, and it's oftentimes done by your PCP as routine evaluation. So when it comes to identifying thyroid disorders, we typically start first with some blood work. We look for the TSH, which stands for thyroid stimulating hormone, which goes very high when a person has hypothyroid, and it can be suppressed, undetectable when they have too much thyroid hormone. So TSH, your physician will probably talk to you about that and check that. And then we can check the actual thyroid hormone levels, the T4 level and T3 level. Other things that can be done is you can check for autoimmune antibodies, what we call a SED rate, things of that nature, as well as imaging, a thyroid ultrasound. And sometimes we do a nuclear scan to see if there's a lot of radioactive uptake to a thyroid that will give us an idea if a gland is producing too much thyroid hormone or overactive. So treatment options, let's start first with hyperthyroid. Treatment options for hyperthyroid, if we diagnose that, can be medication to help regulate the thyroid hormone production. Next, there can be surgical interventions, thyroidectomy, to help limit how much thyroid hormone is produced. And then the third one would be provide radioactive iodine, which will actually essentially ablate the thyroid's ability to function, making a patient hypothyroid, and then we supplement with levothyroxine, which is what your body typically normally makes anyway. When it comes to low thyroid, hypothyroid, we run the tests that we discussed and that are appropriate, and if we find a patient hypothyroid, we typically supplement it with a pill called levothyroxine, or brand name is called Synthroid, and it helps just get the body's natural thyroid, or gets the body's thyroid level back up to where it needs to be so they avoid the symptoms of hypothyroid.